There we go.
And then you have the options to bring us live.
Yeah, I'm gonna do that.
So just so you guys know, Diana's gonna kind of watch the live stream on Facebook, people that are interacting, because there's like a 1.5 minute delay between Zoom and when it gets to Facebook. So that way she'll kind of like toggle questions that people might have for us back to us.
Okay.
Here we go. All right, I'm just gonna say something real quick.
This morning, today my church is having a women's conference, and they were doing a section of the day on mental health. And in the middle of the conference, they announced that they are going to be giving Pinnacle Partnerships some money.
Awesome.
Because we're impacted by COVID in our work, and the women-owned business that's serving the community, and so they want to bless us with something to support our business during this time. So we just found that out like an hour and a half ago.
That's fantastic. Good for you guys. Congrats.
Thank you.
You guys are doing a great job. I'm so proud of you, Kristi.
Thank you. Hustling, bustling.
Yes,
Making
a difference
in everybody's face.
What are we calling this thing? Is there like an official title?
Yeah, parenting children with mental health across the lifespan.
Okay.
And this one is like lived experience.
Okay. All right. There we go. Okay, we're live.
All right.
Yay.
Yay.
What's your connection, Carla?
So, Diana and I were part of a team of family partners and clinicians at a local health center. And we were part of this pilot project that got up and running for a number of years that integrated behavioral health into the pediatric setting. And we were part of what I would say was definitely a kick-ass team of clinicians and family partners. It was just such a pleasure to be a part of like that really strong team. And then Kristi and I work currently together as family partner supervisors for an organization called Family Care Partnership. And we have been just, getting to know each other in the workplace for the past. Have you been there a year now, Kristi?
More than that, actually. Yeah, my year went by like in the winter.
Oh,
I know. It's wild.
it is wild.
So we're up and running on Facebook.
Yes.
Okay. So welcome everybody to our first of 3 Facebook Lives that we are going to do for May Mental Health Month. We are super excited to be able to have a discussion today about the importance of lived experience professionals in the field of mental health and the different things that we are doing out here at this time. So I'm Kristi Glenn, co-founder of Pinnacle Partnerships.
And I'm Diana, the other co-founder of Pinnacle Partnerships.
And I'm Roberta, and I work for Riverside Community Care as a family partner.
I'm Carla. I also work as a senior family partner with Family Care Partnership.
And so today we're going to share our lived experience, some things about our stories, what it kind of feels like to be working in this field, while also still living the life of, being a parent of a child that has mental health needs, the impacts of COVID on our lives, and any other things that come to us. And of course, any comments, questions, anything that you have, please feel free to comment on our page, and we will be happy to respond to that. And Diana's going to kind of moderate our discussion a little bit today, I think.
Yes. So I think before we got on, you all kind of already started talking about it. But could you, Roberta, just tell us a little bit about your lived experience and what it's been like with your son, Connor, right?
Yes, sure. So I am a divorced mother of 3 children, and Connor is going to be 16 at the end of this month, and I have 14-year-old twins. Connor was diagnosed with autism at 2.5 years old, and then around 5 years old, he started to have extreme behavioral challenges, and was really dysregulated on a regular basis. We spent many times in and out of therapists and specialist offices. So eventually he was diagnosed with a mood disorder. There was some talk about maybe early onset bipolar. We've been through a lot. I can say that Connor has been on 22 different medications over the years since he was about 6. So I feel like a pharmacist sometimes with everything that I've had to go through with learning the different medications. I had to really work hard in terms of advocating for him in the public school system. He was not getting his needs met. And I'm sure, like most parents who have children with challenges, whether it's autism, mental health, the battle that you have to go through to get your child the services and supports that they need is extremely exhausting. But for me, it was also motivating. It made me want to really become more educated so that I was more confident in my abilities to advocate for him during these IEP meetings and whatnot. After about a 5-year battle, I was able to get him out of district into the Walker School in Needham. And he was there for about 3 years, and I think that they did a great job. However, his skills were not generalizing across all settings. We were still having a lot of issues in the home setting. Again, I think something that a lot of parents will go through that have children with mental health issues, things like autism, is in the school setting where there's a lot of structure and there's a team full of people, kids are better able to kind of control their emotions and stay regulated. But at home, I feel very strongly that no parent can put in place the level of structure a child's going to receive in the school setting unless they had a team of people like you have in school. So ultimately, I had to really advocate for another couple of years to get Connor placed in a residential program, which was probably the hardest thing I've ever had to do in my life. But I also felt very confident as a parent that I had exhausted every single support and option that was available. I feel like it was extremely important to receive intensive care coordination services prior to the residential setting. When I was going through that whole battle of trying to get him into the residential setting, and things were really difficult at home with unsafe behaviors, a lot of mood swings, a lot of unfortunate, scary things like threatening to stab me in my sleep with a knife or stab his brother and sister, so these things were extremely scary. So having the intensive care coordination services from Riverside Community Care was definitely a game changer for me. I felt like I was resourceful up until then, but then they provided a lot more supports, and I felt like I had allies to kind of sit with me in these meetings when I was trying to prove to the school system that this kid needed more of a restrictive environment. So they were so instrumental. And so at that time, I also realized, oh my God, I want to be in this role. When my life is kind of stable and I figure out how my son is going to get the support that he needs, I want to pay it forward, because I feel like these people have helped me so much with my own mental health and being able to kind of stay calm and have somebody to be a sounding board. So ultimately I was able to be successful in getting him placed in a residential setting, which again was the really hardest thing I've ever had to do in my life, but I know that it's the right place for him right now. And as soon as that happened, within 6 months, I started to apply to become a family partner because I felt strongly about paying it forward. And I really believe that having somebody in your life that has lived experience brings a sense of comfort and a sense of like, oh, this person gets it. So I became a family partner and I was able to start sharing my tricks and trades of the system. I also am very active in the mental health systems because of the experiences I've had with Connor being hospitalized and being boarded in emergency rooms for weeks on end and not getting the support or compassion or understanding that he needs. It's really difficult, I think, for me to understand how somebody can walk into a hospital that maybe has a condition, like a heart condition that you can pick up on a monitor, but if they walk into the hospital with a mental health condition that we can't necessarily put on a monitor and detect, the level of care is completely different. So I'm very passionate about seeing changes in the system. And I also have to speak upon the effect that raising a child with autism and mental health challenges is not only impacting the child themselves, but it impacts the family as a whole. And I saw my other children struggle and suffer. So I've learned along the way ways to support them as well, and recognizing the supports that the siblings need. So I continue to be on this mission and sharing my knowledge and helping other parents that are in the situation advocate. And it will be my mission till the day that I die. I want to see changes, and I feel like there needs to be changes. And, we're in one of the best places in the country, per se, for medical care, and even for the mental health system, some people would argue. But there's still a lot of work that needs to be done, for sure. Absolutely. And I'm so proud to be part of this group and spreading the wisdom and things that we've learned along the way, and hoping that we're going to help other parents that are in this situation.
Yeah, thank you so much for sharing that, Roberta. A lot that you said stood out. And one of the main things is, that really stands out is something that I hear Kristi say all the time, right? That family partners or lived experience professionals have that extra thing that really helps to make other families to feel comfortable and to feel like, okay, somebody gets it, right? Kristi always says, it's like that you had me at hello moment, right? It's like, the second you understand that somebody else has any inkling of what you're going through, it makes a world of a difference in terms of, your own mental health, but then that feeling of confidence that, okay, it's going to be okay. And,
yes.
There's a way. Where there's a will, there's a way, right?
Absolutely, without a doubt. And I think, a lot of times when you are a parent in these situations, there are a lot of people in the field that want to work with children that have mental health challenges who might be fresh out of college and have the best of intentions and want to do everything in their power. But when they lack that actual lived experience, I think it can hinder sometimes their ability to kind of provide the level of support that a parent needs. So then you bring in somebody alongside of that clinician who has that lived experience. And I have seen it multiple times, just to you can see kind of the weight fall, lift off of the parent's shoulders. Like, oh my God, you've been through this. Like you have actually lived this. Like, you get it. Thank you. Somebody that finally gets it. So I think it really does make a huge difference.
Yeah, absolutely. Absolutely. And so what about you, Carla? I know you're also a family partner, lived experience professional. Do you want to share a little bit of your story with us too?
Sure. I will start by just talking about my own biological daughter. I was also a foster parent for a number of years to a young lady, but I'll just share my experience with my daughter, who began showing signs of pretty significant anxiety and depression around the age of 13. And I think it was really difficult for me to identify what was going on, because I think we all recognize that there is that, pubescent period where teens are more angsty, and I did not really expect to encounter what has turned out to be a pretty pronounced diagnosis and experience of those two things. And so I, as a single parent, felt very isolated. I felt very confused and alone in how to meet the needs of this this young lady. And so I immediately began reaching out to school teachers and to social workers in the school setting primarily, to describe what was happening, what was taking place, to describe how this, my daughter, who had been, from my perspective, pretty well adjusted and a thriving young lady, just seemed to be withering and really just changing right before my eyes. And I think what I recognized was that there was not a sense of urgency around me about her experience. And in fact, I had a very difficult time having people return my phone calls, having people respond, because, what I sort of would say about the experience is that depressed and anxious Black girls are a dime a dozen. And so there really was not the same kind of partnership, the kind of partnership, the kind of urgency, or deeply compassionate care that I was looking for, and that my daughter actually needed and deserved as a young girl in the school system and the mental health system. And so that really started it began my efforts to just kind of knock on every door and seek out every sort of support for her. And I was really fortunate in that while I didn't go through formal ICC and family partner services, I was very fortunate that I had a village of folks who came around me. Again, I think one of my strengths or assets is just to be able to ask for help. And so then there were friends who just said, Carla, we are going to partner with you in this. And so I had a lot of support in, going to meetings and really sort of digging deep and trying to address her specific and particular needs. But it was a whirlwind. I think that, again, in the communities of color, a lot of times mental health needs are not really recognized. There's just so much stigma that's attached to seeking help and needing help. And so there was a lot of work that that both she and I had to do to just kind of step into the realm of receiving services and accessing mental health. For a young teenager, the worst thing in the world is to be like socially awkward. And so there was just such a battle in that she was recognizing that there were some real things that needed to be addressed, but the idea of having regular therapy or exploring medication was just it was a lot for her to take on. And finally things got to a point where, this is now I'm speaking about high school, where she couldn't work, and there were times where she was asking me to make up stories so that she wouldn't have to enter into different social settings and situations. And I just remember, thinking, you just have to get to a place where you can receive the help that is out there. And things did begin to shift. But again, I think like Roberta, that experience has informed all of my, efforts to partner with mothers in particular, and families who are having a similar experience. And my really deep desire has been to listen deeply, to really enter into the lives of families and see them. I think just so often we're on this wheel of this machine, and for someone to take time to really offer a presence, and to name things alongside families who maybe have not been able to like put a name to what's going on. I just have found that really impactful for myself, and a really powerful tool of partnership to offer presence. There's a lot of obviously psycho ed and systems navigation that comes along with the work of family partnering, but also just like the power of presence, to know that there's going to be somebody at your side at every one of these meetings, even if you're like a silent presence. Partnership is just such a powerful component in this work. And so, yeah, it's been, I say it's been such a deep honor. It's been such a privilege to be allowed into the homes and the lives of people who are experiencing what I call like these sacred moments, these moments that will forever live with families. And to be a participant is just really a really special thing. And so, I think in my work, my hope is to just roll out the red carpet in any way that I can for women and caregivers. At every turn, I'm looking for ways to really communicate. You are important. Your story matters. You are valuable. Your child has gifts to bring to the community and to the world that nobody else possesses and can offer. And the work is to get all that you need so that you can your child can reach their full potential, that a family can reach their full potential as a unit. And again, I mean, I could go on and on, but to be able to be on the sidelines and participate in any way is just such an amazing experience.
Yeah, and I can speak from experience of being the clinician that was partnered with you, Carla, at that health center, that you did an amazing and phenomenal job with each and every single family that we worked with. I was constantly amazed how you were able to do all of those things within the setting that we were in, right? It was a very fast-paced primary care setting where it was like 15-minute visits back to back to back, which is not what mental health is usually looking like. But Carla still was able to find a way to connect with families on that deeper level and to really walk that journey with them. So I totally appreciate you now for still doing that, but also as your partner back then, really, really appreciated that. Yeah. So one of the major things that, that I saw as a coincidence, or like a thing that both you, Carla, and you, Roberta, talked about was this idea of the authentic relationship, right? That happens with the family partner, somebody who has that lived experience. And then, within the context of accessing mental health services as well, right? So we know that mental health is, technically under the umbrella of healthcare, right? But the way that we're accessing mental health versus the way that we access regular healthcare can be very different, right? I think, Roberta, you talked about your son boarding in the ER for weeks, right? Before getting a bed. And so can you, either one of you, I'll let maybe Roberta, since Carla, you were just talking there, but could you talk a little bit more about that that split between mental health care and the relationships that are necessary in order to move you forward in that space and trying to access that within the larger healthcare system?
Well, I think what Carla said, and the urgency and the stigma part is a huge hindrance still in the whole mental health aspect, in the whole mental health world. I think it's important for people to be educated and understand, especially those people that are working on the front lines of the mental health world. When I speak of the experience that I had with my son being in the hospital, there's one particular time that comes to mind where he was at the Newton Wellesley Hospital for, I want to say it was 8 days or 9 days, and he was 10 years old at the time, and he looks like a typical 10-year-old boy, but the behaviors and the potential hallucinations he was having at the time, gave people that were supposed to be supporting him the wrong impression, and the patience wasn't there, the education wasn't there, the compassion wasn't there. I remember at one point he dropped the remote for the Wii system that they had, and the remote, the back broke, and the nurse came in like, upset and yelling and threatening to take away the Wii from him because he couldn't destroy, hospital property. And I said to her, you can't take that away. That's the only thing that he has. And she continued to say, well, he can't destroy hospital property. And I said, can I speak to you in the hallway? And I said to her, first question I said to her is, do you have any professional training, or have you read any books about mental health in children or autism in children? And she looked at me and she said, well, no, but I've been a nurse for 10 years. And I said, well, you know what? I'm sure you're a fantastic nurse, but you need to have the education and the training that's necessary to understand what this kid is going through. So when I'm in the role of the family partner and trying to help empower the families that I work with, I share these stories and I share the importance of, you're going to unfortunately run into providers in, an emergency, for example, that may not understand and may not have that level of compassion. But my hope is that sharing my experience and kind of helping to provide you with tools and education yourself, that you'll be able to do that when you're in that situation, and you'll be prepared for the fact that, I might have to be boarding in the ER for, a week or whatnot. But in the meantime, I'm going to contact PAL. I'm going to contact my local state and governor. I'm going to contact anybody that will hear me and listen. I'm going to solicit my friends and family to start making phone calls. This is not okay that a child is being boarded in an emergency room and not getting the support that they need. But my famous quote that I like to give to parents and that I use myself is, the squeaky wheel always gets the oil.
It's true.
So don't ever let anybody tell you that you can't speak up for your child, or when you're in an emergency room setting, you can be demanding that they are calling, on the crisis team, for example, asking them, who have you contacted today? Give me some phone numbers to call. I'm happy to call. So I think sharing those experiences and letting parents or families that are in this position know what to expect, first of all, if they end up in an ER, what they should be doing, and that it's okay to be doing those things. And that, again, the squeaky wheel gets the oil, and that you're not alone. There are people that are going through this on a regular basis. I mean, the statistics of kids that are still boarding in emergency rooms is appalling to me.
Yeah.
And I want it to change. I want families to feel secure that if their child is in crisis, that they're going to get some level of support that they need if they have to stay in that emergency room for, whoever knows how many days. So I think it's important to educate our families and share the real life experiences that we've been through and what we've done that's worked to get us out of those experiences, or what we've done to kind of, like that nurse. When I asked her, she said, I have been a nurse for 10 years. And I said to her, well, if you haven't read any books or you haven't had any professional training, then you can't judge, and you can't come into this room and just stigmatized my son as a kid that's out of control or a kid that needs to be disciplined. In fact, I think that's what she said to me. You need to be more strict about your disciplining with him. Mm-hmm. So when I had her in that hallway and I was able to call her out on it, and she acknowledged, I don't have any of that training. So I say to my parents, advocate, that somebody that is in a hospital setting or an ER setting, that they have people that are trained on staff.
Yeah.
You know, I think, you know, there's a handful of hospitals that perhaps have, monitors or whatnot that will sit in the room with the parents. But again, they're not generally people who have lived experience.
Right.
We need that. Our kids need that, especially for parents who have more than one child. Again, like Carla, I'm a single parent. I had 2 other children at home, and I couldn't leave my son because I felt like he wasn't going to be treated appropriately or cared for appropriately. I was afraid. So again, sharing these experiences, I think, is a huge component in educating and helping to prepare families for instances that may come up like this.
Yeah, absolutely.
I think also a lot of times parents and just in general, people relate the emergency room to a physical ailment, right? And so I think for families who, for their first time, perhaps, or if it's their even sometimes 10th time, and I know a lot of families who've been in the ER 10, 12 more times with a mental health condition, it still feels like that environment is primed for only physical ailments, right? And so it already seems like there's a barrier right from coming in the door. And then you've already gone through as a family whatever has happened in your home leading up to you actually getting to the point where you're like, I have to go to the ED, right? So you're on the edge. It's like you need a glass of wine or what, you're like, everybody's on edge. You're worried about the siblings. You're trying to hold it together yourself, right? We always want to be able to help calm our kids down,
right,
or make them feel better. And then you come into a place and you're already fragile and you're open and you're grieving and you're sad and you're tired and you've given it everything that you have. And to come into an environment where people's reaction or response is not that of partnership with you, in that it is blaming or shaming, or, to make a statement like you need to, discipline your child better, is like, if you think, oftentimes I've said, I have a child that's, 6 years older, that we're not having the same experience. So I don't think that disciplinary or parenting is the challenge here, and so that is always something that I try to, in my work, talking to providers and to educators and other people, is to really try not to go there initially with families. Like, you have no idea the war zone that families are living in. I've often shared that prior to my son going into residential, we had a number of hospitalizations. We were at, I think, 8 hospitalizations before him going into a residential setting, which he was there for about 9 months. But that he went into that residential setting when he was 7. So that 7-year-old kid shut my house all the way down, and I'm an adult. But we were at a point where, excuse me, my allergies, because he was so unsafe, and it was like everything he could turn into a weapon. Like he'd pick up this tissue and somehow it was like a weapon of some sort. We only had literally in his bedroom a mattress, not even the box spring, because the box spring was heavy. It was, the edges were kind of sharp, and it was like almost like a padded cell, right? And that's what we were up against. For me, trying so hard to keep him home and to not have him be out of the house and to access appropriate services. And that was with an intensive care coordinator and with in-home therapy, with a therapeutic support, with psychiatry, right? So we were hitting all of the things that we were supposed to be hitting. And I still had a younger sibling that was trying to watch all of this and make sense of it. Our safety plan was, if he flies off the handle, you go lock yourself in your bedroom. That's a terrible thing. So it's just to be able to, in this field, share those experiences with other families who are just walking into it, who feel very much alone, isolated, like these no, I've never seen, oftentimes, these aren't things that people walk around wearing on their chest and talking about at the PTO, right? Like, these are
Right.
things that people keep inside. They don't share it, and that's the stigma is there. And so to me, that's why it's like that. You had me at hello, right? Like within 3 sentences of that, if you've had anywhere on that spectrum, that kind of an experience, as a person of lived experience, that connection to a caregiver who's been in their house dealing with this and not knowing what to do about it,
Mm-hmm.
in trying to decide, am I supposed to go to an emergency room?
Mm-hmm.
That's where people go when they get into a car accident or break their leg. Like, is this where I'm supposed to take my child that's seemingly out of control, right? And that is a really difficult place to be as a parent.
I have to echo on that, Kristi, and I think that's why it's so comforting to some parents who can see us as family partners or people who with lived experience that we're still standing, that we're
Mhm.
still alive, and we've come this far, and that there is light at the end of the tunnel. It might take some time to get there, but with education and strength and knowledge and confidence, you will start to see that light. And we're examples of that. That's one of the things I like to say to the families that I encounter with, like, who are in that, heightened level of crisis where they're, calling the crisis team 2 or 3 times a week, feeling like I don't know what to do. I'm just helpless. It's never going to end. I can't do this. I don't know how to help you. Well, there is light at the end of the tunnel. Let me tell you how. So I think that's a huge component of, that lived experience piece, is being that live example that we can get through this. You're not alone, and there is hope.
Mhm.
And there's more and more hope, I think, every day, because there's people like us who have a passion for helping other parents and families get through these times and sharing our experiences.
Yeah.
I'm always struck by the craftiness of people who have gone through it before. I feel like the way that I've learned to navigate the system has been largely because of the family partners that I've worked with, right? So whereas before I would hesitate to maybe call a certain person or escalate an issue or email somebody, it's like the ways that family partners are able to get things done and tell families, like, okay, if if you go down this path and you hit a dead end there, this is what you're going to do, right? Family partners are able to lay out plans A, B, C, all the way through like G for families. And I just think that that's so amazing and makes such a huge difference, especially in a system where there's such a huge bottleneck and people are having a hard time accessing. And while they're having a hard time accessing, life is still happening and things are still occurring and things are getting worse. So yeah, I just think it's amazing.
Mm.
I'm just in the essence of time. I'm just want to give everyone like a quick time check. It's 3:45 or almost 3:45. And I want to touch on, obviously we're all in the middle of this pandemic. It's why we're not all in a room together right now discussing this, right? So Carla, could you talk a little bit about how COVID-19 has affected your work and the work with the families you serve?
Mm-hmm. Yeah. So the catchment area, or the area that I find most of my work happening, are in neighborhoods that are where the infection rate is 3 and 4 times what some other communities are. And so there has been just real alarm with families and families, many who are housebound as a result of this situation, who may not have be as mobile as some others, who may not be able to get to the grocery stores or access places with great ease, or without having to have children in tow. And so for me, it has meant that a lot of my days are looking like doing house visits and dropping off sort of like basic necessities, like doing porch drop-offs. It's just a lot of trying to have like the very basics covered. And then on the sidelines, discussing mental health, talking about mindfulness, talking about ways to continue to stay in the body and continuing to sort of be grounded, because there is just such a sense of anxiety that I think families are experiencing around the prevalence in our communities, and two, just this sense of unknown, just not having any of the structures that have been in place. School is out the window, camp is out the window. All of the daily norms have been turned upside down and upset. And I think that is just really, it's just created a real heightened sense of panic and anxiety, I think, for families. And so really, again, as I just said, it's the work has been twofold. It's been, what are the practical basic needs that can be met, and then how do we sort of just keep everybody, how do we support families and sort of just remaining grounded, hopeful. Yeah.
Mm-hmm. Yeah. Kristi and I have been using the phrase pandemic trauma to kind of highlight what we're all going through right now, right? So this is one experience that we can say, and there's kind of a bright side to it that, we're all going through it. And so we, there's hopefully going to be a lot more empathy that comes forth in terms of people being really understanding of one another and the ways that people are dealing with this. And one of the things that has come out in more recent days has been that whereas before it was 1 in 5 children struggled with mental health conditions, over half of children now, since schools have been closed, are reporting mental health needs and challenges that they're requiring services for. And so, we talk about mental health being on a spectrum from, very mild to, very, very challenging. And now we're just getting more and more kiddos who are inching more towards the middle of the middle of that spectrum. And so, a lot of our work here at Pinnacle is thinking about what that's going to look like once the pandemic is over, right? Whenever that is, because we know that with trauma, the effects of it aren't really seen until the aftermath, right? When we're trying to go back to normal. So right now, like you said, Carla, people are really focused on what are the basic needs? What are the things right in front of me, right? Do I need masks? Need gloves? Can I go outside? How do I keep up with schoolwork? And then, once all of that starts to settle, once that dust settles, I think we'll really start to see, an upsurge in mental health, which is, unfortunate, but then also hopefully helps to bring about that sweeping change that I think we're all kind of looking for in terms of access to services and that compassionate care and, that training that we're hoping providers will have in response. So what about you, Roberta? What have you been noticing?
So, I absolutely agree with you, Diane, that, the increase in kids and families in general struggling is scary, especially because there is a limited access now to services. I know that my agency, Riverside Community Care, has really been trying to promote the fact that we're offering supports virtually. What I'm finding is, there are a lot of kiddos and families that virtual component may not be the ideal method for them. Nothing can replace, I guess, the person-to-person interaction. I'm trying to really make sure that families that are struggling, especially those families that may not have had mental health struggles in the past, but they are now because of the situation that we're in, to access the services. It's not maybe in person with the person right next to you, but the virtual or the telehealth method kind of can still provide you with that, the talking and the therapeutic support that, you may need brainstorming ways to get through whatever rough days that you're having. Or, I'm also finding that a lot of families are struggling that are not getting the same level of supports that the kid would get if they were in school. And, I'm one of those. I have another son who struggles with anxiety and OCD, and being at home and not having that face-to-face interaction has really taken a toll and heightened his anxiety. So I'm finding that a lot of families are feeling that stress. But what I'm trying to do is really kind of encourage them, even if you think that you're not going to be that kind of online type of person, or you don't think that it's going to be as effective, give it a try, because the people on the other end are passionate and really vested in this work and really vested in helping families through this time. There are still supports out there, and they may be virtual right now. And even if your child or family member is having a hard time accessing the virtual support system, the people on the other end can maybe help you brainstorm ways in which to get them more comfortable. My son's in-home therapist, they went to virtual telehealth, and at first my son was just completely against it. It made him more anxious. He didn't want to be seen on the camera. So we have a good therapist, and he said, you know what? I feel like we've reverted back to how your son was prior to the pandemic. So what I want to do is kind of go back to that, just him and I kind of having sessions on FaceTime, chatting about video games, and kind of slowly building back up. And that works. That has shown to be working. He's becoming more engaged. So I think, one of the things that I'm seeing is a little bit of apprehension of taking advantage, or lack of knowledge that these services can be accessed through telehealth methods. So I really hope that anybody that's watching or decides to watch later realizes that although we're all stuck in the house right now, we are all in this together, and there are supports that are available. And I would just encourage people, give it a try. If it ends up not being your forte, then that's fine. But I feel like if you give it a try, you may actually realize, wow, this is helpful. Even joining groups like this, that include clinicians and parents with lived experience, just having that opportunity to kind of hear other people's stories and what they're doing to get through it could be helpful for sure.
Yeah, absolutely. Absolutely.
The other thing I think that I'm experiencing with the COVID is I have a child that is in residential currently. And there are a lot of families in my network of warrior moms and parent dads that aren't able to see their children right now. And that causes a lot of stress on the parents and a lot of sadness. And even for me, I think Mother's Day, I was, just in a glum state because I wasn't seeing my son, and I'm having to listen to him ask questions. When am I coming home? When is this going to be over? And I remember going on to one of my wonderful warrior mom groups on Facebook and seeing other people who are going through this at the same time, and just reading the comments. Sometimes I don't even comment. I just read, and I see what they're doing, and I see that people are encouraging them, and other mothers and fathers are in the same boat. And it makes me feel like, oh, okay, I'm not alone in this. And I do have people that are in this with me, and we are going to get through it, but it's going to just, one day at a time. But having those support systems is huge, I think, for parents and families. So access them, give it a try. Even if you don't think it's going to work, give it a try. You might be surprised.
Yeah, absolutely. That's really, really good advice. It's an interesting thing, because my therapist colleagues who do see children and families have noticed that they're not getting as many referrals, right? But then we know that the number for the need is going up. And so I think what you're saying is really true, that people are a little bit apprehensive about what teletherapy can do. People are apprehensive about the therapeutic process anyway, especially if you're new to it. And then having to try to form a connection with somebody over FaceTime or whatever you're using can be really difficult. But yeah, I agree with you that giving it a try, and just like with regular therapy, if it was in person, if you didn't like your therapist or you didn't like your experience, you just find somebody else, right? So
I also think about in the future, moving forward, when this pandemic is over, I remember myself when my son was at home and the amount of specialist appointments and therapy appointments and med checks and trying to juggle getting to those appointments, getting him in the car, and the anxiety that would cause for him to get in the car if we, God forbid, got stuck in traffic. So I'm thinking that if people give this a try and more people recognize that this is an available option, think about not having to get your kid who's struggling with transition or doesn't want to leave the preferred activity that they're doing to go to their med check, which really basically is just kind of checking in and having a conversation. And maybe telehealth moving forward can be an asset for those families. They don't have to be going to these several different appointments every day, especially single parents that have more than one child. You know, it's a lot to juggle. So I think the telehealth aspect right now this is the time to try it. And because I think it's going to be more part of our daily lives when this pandemic is over.
So we have a couple of comments here that I want to make sure that I get to. There's a Cheryl here who's saying, hi, Roberta. I don't know if you can see.
Cheryl is my first warrior mom. She was my first mom. That was when I was a family partner, and she's been so far.
So she's saying hi.
Hi, Cheryl.
People are agreeing with the advice of trying out the teletherapy and seeing how it goes. Tiffany had made a comment a little while ago about healthcare systems and understanding mental health. So people are definitely resonating with what we're saying here. And then I have a question from someone where they say, from Jennifer, where she says, where can they get referrals? Must families first go to the hospital in Section 12? So I think that's a question about, you know, how can people access therapeutic services? Does anybody want to take that? I mean, I could, but.
I can.
Did she say where she lives?
So full disclosure, Jen is my cousin, and she is a police officer, so she is interfacing with mental health in a different way.
Oh.
The Section 12, I think, is probably coming from that perspective, where that's typically, or one of the ways that police may.
In my role as a community engagement specialist, I have visited police stations and schools alike, and you know, it is pretty discouraging, I guess, for lack of a better word, that people like the police, who kind of are first responders in a lot of these situations, aren't aware or aren't educated, not by their fault, about the services that are available. And so many times kids are, you know, maybe sent to emergency rooms when perhaps getting involved with a community service agency like Riverside, for example, and getting wraparound services might prevent that in you know, the future. So going into police stations in the catchment area that we serve, I found the police to be very receptive. What I ended up doing was handing out postcards that the police officers could carry in their cruisers. So when they are getting called to these homes where kids are dysregulated or being unsafe, and they felt like, oh my God, now I actually have something I can give to the families where they can get resources. I think often, a lot of times too, police are so inclined to call DCF when they don't have other alternatives, which can open a whole other can of worms. So I think it's important for police, you know, agencies and police stations and officers to know that there are community service agencies, but you know, such as Riverside, which is, you know, one of the biggest ones in Massachusetts, but there are other ones. I would encourage them to access their local community service agency. I'm sure that they would, you know, be happy to do a training for the police department. You know, and now I'm seeing a lot of police departments are also having clinical social workers on staff to kind of help navigate when these things happen. Sure. Even in my encounters with those people, they weren't aware of the community service agencies that are out there. So I think getting the word out is going to help a lot of, you know, the people that are first responders, so to speak.
Yeah, Jen, BAMSI is one of them. She asked if BAMSI was one of them. So yeah, I think you're highlighting, Roberta, that there's a lot of resources available that people just aren't aware of, right? They just don't know what's available to them, what's in their backyards, right? And especially with mental health, I feel like part of it is stigma, part of it is, there's a lot that goes into why people aren't aware of what mental health services are available in their areas. But one place that I always tell people is a good place to start, especially if you're like completely unaware, is pediatrician or whatever medical provider. A lot of times they may have connections with mental health professionals in the area. I sometimes like to send people to insurance companies, but we know that the providers on their lists aren't always providers that are really actually providers. You might have a number to McDonald's, but it says Dr. So-and-so. So that's happened. But yeah, and then, here at Pinnacle, one of our major things has always been that if we're not able to provide the service, between Kristi and I, we know people across the state, and we're happy to connect. So if anybody ever has any questions about service providers in their area, please reach out to us on our website, and we'll help connect you.
Yeah, and we can also drop some links to some different places, like a list of all the CSAs statewide, into the chat after we log off, so you can access all of the different community service agencies and CBHI, which is the Children's Behavioral Health Initiative, for some services, which is a place to the place where you're going to largely be able to access intensive care coordinators and family partners in the state of Massachusetts right now. There are other types of places like the Parent Professional Advocacy League, PPAL. BMZ has a place called PIN, the Parent Information Network, where they have some lived experience professionals. There are places around that also have other places. So we can drop some of those links in, and you can always contact us around that. The other thing that I just want to make sure that we touch on quickly before we wrap up, especially in thinking about COVID and kids being out of school, is just making sure that we touch base on the importance of education, and that all kids are due an effective education.
Right.
And that there are going to be a lot of kids right now who are going to be coming back into schools, and whatever schools look like, and whenever schools open. And I think Diana and I have been very anticipatory in talking with people about the fact that schools may not open in fall.
Oh,
and if they do open in fall, we don't know what they may look like. And so I think we are of the mindset of like planning for the worst and hoping for the best, right? But this has been very slow. And so that's something that we're kind of saying to everybody and in all forums, is to try not to rush back, because who knows what it's going to look like or when it's going to happen. And the information is changing every day, it seems like.
I think that's a really good point, Kristi, about the education. I myself have been working with Health Law Advocates, which is a great agency. I think if you could include their link, that would be awesome. They're doing a lot of workshops and trainings for parents right now, and kind of learning how to document and record and everything that's going on with their children's education or lack of right now during this period. And they have some great cheat sheets, for example, for parents to use, so that when we do go back to school and these kids are struggling with getting used to being back and all of that, the level of supports is probably going to be on the increase. So Health Law Advocates has been offering a lot of help and training, kind to help prepare parents and families and caretakers for now and for when the schools do reopen. I don't think we're alone when we say that, most people that are in our network of families are struggling with the home component in terms of their children getting the education that they're entitled to right now.
Yeah, absolutely. And so, you know, everybody has the right to seek out and ask for testing and evaluations and have their child screened for an IEP, which is an individualized education program. There's no shame in that, right? The days of old of what special education looks like is not now. And, you know, let's not let those old ways and stigmas stop us from accessing the supports that our kids are due. And if they need them, like, let's get them the supports we can. It's a great way if you have a family partner or if you need somebody to help you navigate what can be a very difficult system to navigate. Some districts are better than others. That's just the reality. Not everyone needs an advocate. A lot of people go through and are able to access IEPs and other types of educational supports with a family partner who can help educate them. So there's lots of different ways that lived experience professionals like us can help support families or other agencies and helping families to get what they need. But don't be afraid to ask. All you have to do is write a letter to your district saying, I want my child to be evaluated. Put a date on it, sign your name, bring it, have them stamp the date on it, get a copy of it, and you have started the process.
That's right.
It's that easy. And then the ball will get rolling from there. So it's really important in these times because, like Diana said in the beginning, 50% of kids are now identifying.
Yes.
They're having some struggle with mental health, which is a huge number. And as they come back into schools, you know, what that's going to look like for kids. Are they going to want to go back? Are they scared? Are they going to want to be near their teachers, their friends? That will likely increase, right? And maybe for some kids it will decrease, getting back to normal, but there will also increase. And so everybody's response to this pandemic trauma that we are all experiencing right now is going to be different. And there's no shame in that. And we should just be supporting each other. And so you can always reach back out to us here at Pinnacle. And I don't know, Roberta and Carla, if you guys want to give some information on how to access services through each of your agencies.
Sure. I can be reached at rbiscan, BISCAN, at riversidecc.org, or you can send me an instant message on Facebook. I'm happy to help navigate or answer any questions that anybody might have. And please don't be shy, regardless of what you might be going through or how you might be feeling. You're not alone, and there are supports available, and I'm happy to share what I know.
Similarly, I can be reached at cbooker@familycarepartnership.com. I too am willing to respond to all inquiries related to what's happening with COVID or just anything that may be happening in the early childhood mental health realm. I welcome questions. Again, I think that this is a time where we really do need to be reaching out to one another and just be transparent about what the needs are. So I'm glad to be a resource if possible.
Thank you so much, Carla.
Yeah.
Thank you both for joining us today and for sharing your stories. I always think it's so amazing how vulnerable people can be in sharing their stories. And we know how powerful that can be for folks when they can hear, like we've been talking about all day, that you know, somebody understands what they're going through. Children's mental health is challenging, not just for the child, but for the parents and the caregivers and family as a whole. And so as much as we can build community and partnership around one another to help support each other, it's going to make a world of a difference. And so I really appreciate both of you guys joining us today and having this conversation with us.
My pleasure. It was a great
time. Thank you for the invitation.
Thank you for spreading awareness and making sure that these supports are put out there and people, you know, reaching more and more people in this way. The more people we can reach and educate and empower, the more likely we're going to be successful in making those changes that are so needed and stopping the stigma for sure.
Absolutely.
For sure. Thank you both so much. And we'll be back next Saturday at 3 o'clock with our next topic, which is actually going to feature parents who are currently raising children with mental health needs that are receiving residential care. And so we have 2 or 3 moms that are going to be on and sharing their experiences with us. And so we're really excited for that. And then we'll have one more Saturday session the week after that. So thank you for everyone who's tuned in on Facebook and for all of your comments. And we're so glad, Carla and Roberta, that you were here with us today and shared all of your knowledge. And it's a great way to spend a few moments on a Saturday with like-minded people who are out here fighting the good.
Totally. Yes.
Yes.
Warrior moms, hear us roar.
Moms.
Love
You guys
it.
all have a great rest of the day.
You
Bye.
too. Bye,
Stay
everyone.
healthy and stay safe, everybody.
Enjoy the sun if you can.
Yes, it's starting to get cloudy, but fingers
All right.
crossed.
Yes.
That's right. Right. Bye, ladies.
Bye.
Take care. Bye-bye.
Go.
Okay, stop the live stream.
Okay. Oh, Roberta was out.
I know.
Oh, and Carla.
They're like, bye. Oh my God.